Hello everyone, I'm Lavrentia Valiona, and today a surgeon came to see me for a consultation. Can you imagine? That's how it happens sometimes when surgeons come to podologists. The thing is, he pinched his finger. It was really bad, just very basic. He seems to have released the blood, and some time has passed since then. Apparently quite a bit of time has passed, considering you can already see the lunula. And his complaint is that this nail keeps catching on things a lot. And since he is a practicing surgeon, of course, this is absolutely not acceptable for him at all. It's not safe, he could even tear his gloves, and in general, dirt accumulates there. He understands this, but he can't do anything about it himself. And he also fully realizes that what is needed here is not surgical intervention, but simply proper, careful cleanup. Overall, we spent our time well, had fun, and enjoyed a good conversation on the topic. We discussed which cases require a surgeon's intervention and which do not, and this particular case really doesn't require it, because everything has long since healed and everything is fine here. It's just that there's a part of the nail plate that's not attached to the skin, and of course it needs to be removed because there's a complete void there. And if it weren't for his wonderful habit of keeping that pocket clean and rinsed, who knows what could have started growing there. Fortunately, he's a responsible person. After all, he's a doctor and took this very seriously. So, what are we doing? I carefully trimmed around the edge here with a drill, making the nail thinner, and now I'm using clippers to remove the remaining parts that are still attached. And now, like a door to Narnia, the little cover opens and we can see what's inside. I'm showing him this too because he was curious about what bare nail beds look like, and usually in theory it just looks like it's not attached anymore, so there's not really any strong sensitivity. And those brown spots you see are remnants of dried blood, a hematoma, or simply a bruise, to put it plainly. That happens when, after a blow, blood collects like this between the nail bed and the nail plate. Often, people who go to the emergency room have it punctured with a syringe there. You can even do this yourself at home. But basically, the point is to release the accumulated blood because it will be very painful and you'll have this feeling like your finger is about to burst, a pressing, stretching, unpleasant sensation. But if you take a sterile syringe and a needle, which you can buy at the pharmacy, and carefully pierce only the nail plate at an angle, you don't need to pierce the finger itself. Of course, then everything will be great. The blood will just come out, you'll feel relief right away, and in a week or two everything will gradually return to normal and you can do the cleaning in just a few days. Well, of course, it all depends on how severe the injury was, but generally, this could have been done much earlier than when he came in. So, the person waited through the pause that he thought was necessary, and nothing terrible happened here. As I said before, he did a great job. He rinsed, monitored, and observed. He just didn't have the necessary tools to work so precisely and in such detail. Because in this situation it's very important to have sharp clippers that can carefully trim the nail without crushing or breaking it. And also a rotary tool like the one I have here, a carbide ball bit, which can also very delicately, with a steady hand and proper control, perform this kind of cleaning. Because here I put a lot of effort into stabilizing my right hand and working only on the dry part, meaning only on the part of the nail plate that doesn't feel anything. If I accidentally touch the nail bed with this carbide ball where it's not protected, it will be extremely uncomfortable. I understand that in the video it looks like I'm just moving the bit back and forth, but believe me, these are very deliberate movements developed over years. So, and I'll finish up some small details with nippers. Sometimes I even use cuticle nippers. Here we're checking sensitivity to make sure nothing is catching, and since we're satisfied with everything, I take the drill now. In this case, I chose the blue band because a lot of time has passed and he doesn't have increased sensitivity. I can calmly file down anything that's sticking out a little, any small parts of the dry nail, the nail bed, and so on. This is necessary so that as the nail grows out, everything will be comfortable for him. At the end of the video, by the way, I'll include a photo of how the finger looks now, but just to let you know in advance, I can say that it looks normal. Just like usual, you wouldn't even guess that anything happened here. Because I often get questions like, will a nail like this really grow back? Will everything be okay with it? Will it look nice? Yes, it will, with proper care and careful cleanup. And after this kind of cleanup, I strongly recommend using oils. A lot of people kind of dismiss them. But oil really is important. It improves flexibility, moisturizes, and helps nails grow faster. For one simple reason, when you apply oil, you are actually giving yourself a massage. That is, oil needs to be rubbed in, and without even realizing it, you're basically giving yourself a massage. But if the oil is also professional grade and has preventative benefits, then that would be just wonderful. Here at the tip we still have a little bit of hematoma left, which we won't clean up because the bed hasn't separated there, meaning that part is still attached. So there's no point in touching it, and basically the cleanup is pretty much done. Now it's just the tiniest details left. And the best part is that after these procedures, when we apply the oil, you'll be able to see, actually you'll see it in just a moment, even after the antiseptic, the finger already looks much better. And if the client keeps moisturizing it regularly, it will hardly be noticeable and it will grow out comfortably. So that's how everything grew back. Everything is in place, everything is good, the finger looks great, the surgeon is back in action and working happily. Thank you all.